So my role in the residency is to take folks that have decided to come to the University of Michigan to do their clinical training and to look for opportunities to expand what they're working on from a purely clinical perspective and say, are there other academic and potentially research-related questions that they might pursue while they're here? There are many places to train in emergency medicine in the United States. There are far fewer places where a trainee can walk in and say, while I'm at it, would it be possible for me to write a very influential paper asking a question about how we take care of patients, or how patients get sick, or how to prevent patients from getting sick? Can I do that while I'm here? And my job as the Associate Chair for Research is to find a way to make that happen. From a research perspective, the residency at Michigan is unique in the breadth of the interactions of our faculty across the institution. We are a department, but from a research perspective, we are much more broadly collaborative. We have very close collaborations, not just with other departments in the medical school, but with other colleges at the university, the School of Public Health, Literature, Science, and the Arts. We have extensive collaborations with the College of Engineering. We have extensive collaborations with something called the University of Michigan Transportation Research Institute. So we are a citizen of the broader university. And while on a daily basis, your clinical routine may be focused in a very small bit of institutional geography, your research experience here is very broad, and we're bringing you in contact with people you never imagined being in contact with before. We see many patients that live in Ann Arbor, that live in Southeast Michigan, and we're their provider. But we also see tremendous numbers of patients that come from very far away because we are the provider that knows what to do. It is very common to, in the course of a morning, to care for someone who lives about 10 minutes away from the hospital, and then one bay over to take care of someone that lives 4 hours from the hospital, because there's simply nowhere else that they're going to be able to get the things that they need except at Michigan. And while much of that involves collaborative work with subspecialists and potentially numerous subspecialists, a key feature of our role in that is that when that patient comes by helicopter, by ambulance, by car, from very far away into very foreign territory, that we know all the people that they need to meet if they haven't met them so far. And a lot of what we do in terms of caring for them is not dramatic, it's not what you see on TV, but it's what matters, and that is we are going to take 2,000 physicians at the University of Michigan, and we're going to bring the ones together that need to be there now, and we know who they are, and we know how to assemble them, and we're going to get things taken care of. And that's different than I think a lot of emergency medicine training experiences are like, and I'm extremely proud of that.